So, colleagues, good evening. There is no one who's here today who would not acknowledge that when you look out of the windows, and for those of you who have been out, the warm, glorious sunshine is definitely there. Okay, there is no doubt about it. And it does bring this sense of positivity. And for people like me who are absolute champions of primary care, it brings this feeling of this dawn of recognition that perhaps primary care is at the cusp of a place where people recognize that it is without a doubt the leader in leading healthcare services to a new start. Now, what's fascinating is I was reading this news the other day that patients who are on waiting list would be directed back to primary care until they're waiting. And many of us have been on a waiting list for a bit of time. It was a bittersweet reminder, perhaps, of the fact that, yes, primary care bears a lot of the load of what we do. But more importantly, there is definitely a recognition that if primary care is involved in the solution finding for a healthcare issue, the answer would be more robust, better, and much more resilient. And that's exactly what this particular article evoked in me. Now, clearly, it is not something that's been implemented, it is just an article, but it shows the power primary care holds. Colleagues, for those of you who don't know me, I'm Mohit Venkatram. I am a doctor by background. I am the Deputy Chief Executive of Northeast London Foundation Trust, and I'm both the host and the creator of this series of webinars called The Future of Primary Care. Now, clearly, as an organization, we recognized very early in NELFT that if we were able to work with our primary care partners, we would deliver services that were much richer, much safer, more streamlined. And hence, as an organization, we put in our resources to support this webinar, because we recognized very early that together we are able to provide our residents locally a service that is very high on satisfaction. That's something many people ask for in the NHS. It's easy to access, something people like me would also want very much so. It's quicker in terms of the point of care where it provides it. It's more resilient, it's safer, and it's also cost effective. It's like one of those combinations that's a marriage made in heaven. Now, as a resident, what would I want personally for myself? I've shared with you all men quite often that I have long-term conditions. I've got cancer, and I get treated in the NHS very efficiently and effectively, for which I'm very grateful to the services my clinical teams provide. But what I would like is quick, easy care from the professional who is most appropriate to care for me. It doesn't have to be a doctor, it doesn't have to be a nurse. It could be the professional who's most appropriate, so that I had the power to manage my life in a way that truly makes a difference. And that's what primary care is all about. And that's why, as a trust, we were very clear that our resources investment into creating spaces like this allows us to provide much better care alongside our partners who are our GPs and our wider primary care colleagues, so that we were able to make this difference. Now, clearly, if we are going to talk about primary care, there is no way not to discuss at this time their delivery. The data for April has just been published, and in April alone, primary care saw 30.2 million appointments in that 1 month, which is phenomenally more than what used to happen previously. You'll remember the data I've been sharing, it used to be somewhere around 28 million, 28.5 million. So almost 1.5 million more appointments that have been happening. 44% of these appointments, in fact, slightly more than 44%, were same-day appointments. About 90% of these appointments, pretty static and consistent with previous months, were attended by us. And about 65% of appointments were face-to-face appointments that were carried out. So clearly, you can see that it is a group of professionals who are not just making a difference, but making a phenomenal difference to the speed, the agility with which healthcare is being provided to people like us in the community. The question then arises, what are we going to do to change the way this healthcare is delivered? Because when we look at the data and talk about 90% of appointments being attended, that's 10% of appointments being lost, which means about slightly over 3 million appointments were lost to the system. So how do we as a group of professionals feel empowered to make that change so that the healthcare services are part and parcel of how we would envisage them to be? How do we take charge of those healthcare services and are equal partners in this delivery? Now, clearly, it is a tussle, it's not easy. But then, if we have to make that change, we need champions in this pathway. There are very few people I have met in my life who have boldly taken the stand on a stage to say that they have developed a system where the residents are equal partners in the delivery of care, are equal partners in the way the system functions. And clearly, I am so pleased to say today, with us on these webinars, we have a multi-award winning project manager who's making enormous waves in the way the digital space is being led. Marta Fischer, our guest today, is one of those fabulous, unique brand of leaders who has managed to combine her passion for digital technology in a way that you can place trust and, more importantly, power in the hands of the local residents. Now, how often have I said that the consequence of non-experts running a service that requires very specialist knowledge can be disastrous? But the reality of this is, who is the expert we are talking about? The clinician who knows everything about the disease, or the resident who knows everything about their life? The reality is they are both the experts. And today, we have a leader in Marta who recognized that perhaps if we combine the power of both these experts, we will have a much better outcome for our residents. Of course, I will leave Marta to share her amazing journey, which no doubt is going to be incredibly moving and very powerful. But just before I hand over to Marta, let me remind colleagues that there are almost 200 of you who have registered on different platforms. So some of you are on the Zoom platform, some are on the other LinkedIn platform, etc. But if you have any questions you would like to ask Marta, please use the Zoom platform on the Q&A button and post those questions. We will pick it up from there and we will share it with Marta based on the themes of those questions that are presented. For colleagues who have already emailed me in advance their questions, please be assured they will be picked up. So, without any further ado, Marta, thank you so much for joining us today. Can I hand over to you to share your thoughts on what you've been doing in this amazing world of clinical leadership with patients?
Good evening, Mohit, and good evening, everyone. And thank you for such a warm welcome on such a beautiful, warm day, as you can see behind me as well. I've got the great pleasure to be here and talk about this fantastic project. more specifically about one, but holding several initiatives across our ICB and working with our primary care and citizens. And specifically, we'll be talking about digitally empowered citizens leading GP technology implementation and how we actually make them to do it. So if I could please ask everyone to move to another slide. Thank you. On this slide, you can see myself in the community meeting recently. But I just wanted to give you a little bit of the background, how I actually started this community meetings. About 40 years ago, I found myself in one of those community meetings where my mum was engaged with local people, striving to bring about change in post-communist Poland. At the time, I did not appreciate it. I wanted nothing more than to be with my mom, playing and having fun. And those meetings seemed hideous to me. But now I realize the profound impact on my development and experience. And I learned that the true change and transformation begin within the community. Working together is rooted in dialogue. Every conversation, and no matter how brief, has the potential to uplift, ignite ideas, and inspire lasting change. And this understanding sparked the creation of few transformative projects in our primary care. Starting in 2022, our ICB recognized the need for cohesive digital strategy. Strategy emphasizing not only importance of digitalization and innovation, but also patient engagement and digital inclusion, especially digital exclusion. Our goal was to directly engage with citizens or patients, from our point of view, while promoting digital services. And through this engagement, empower them to use the technology. Our goal was, in January 2024, we rolled out the first of our projects, digital cafes. And those digital cafes are not only stationary hub or space. Digital cafes are service. It's a service delivering essential digital support through meetings with the community and health events. It is also a service dedicated to support primary care staff in promoting better access to healthcare through ongoing training and drop-in sessions for patients on site of the primary care. It is a service delivered without any funding or extra cost to NHS. I just want to highlight this. Service effectively harnessing existing channels, resources, and community projects around primary care, local authorities, voluntary sector, and various partners. And delivering empowerment, influence, prevention, financial service, trust, and resilience. Can I please have to move to another slide? Thank you. And since we started rolling out this project, our team has proudly established 17 stationary digital cafes and delivered over 100 drop-in sessions across their primary care and community. We supported now over 2,500 people, which is over 1% of our population. And we also delivered technology to them, delivered all NHS laptops, we delivered mobiles donated to this project, and to those in need in our community. The sessions we deliver support citizens with actually just basic skills, such as how to use email, download the app, apps such as even WhatsApp to stay connected to family. But we know that these skills are transferable. And we know that every session every session is helpful, and also we make sure that every session includes spreading awareness about digital health, how to access health information, and what tools are available to everyone to use our services more conveniently. So every person will leave this session with information about digital health. And for many, from my own even experience, knowing how to access their own health information, such as health records, test results, or letters, feels very empowering and feels surprising. And they keep coming back and look at these documents. But more importantly, after the sessions, people feel they have a choice. And for most of them, this choice is digital. Last year, one of our social prescriber in local PCN conducted small research in which talking cafes, which are social meeting and place where people can express any problems and concerns to social prescriber, were compared to our digital cafes. And the results showed that majority of people declared that digital cafes have significantly increased their well-being. People left learning something. And they often report to us that those small things they learn in digital cafes are life-changing to them. And this is how the change happens, how the transformation begins. These sessions increase safety, inclusivity, and well-being. So you can see these wheels basically working together to deliver the big picture. Looking at this big picture, the change started in those small community meetings or on site, these little sessions in primary care, influenced transformation into entire integrated system. We know that over 90% bookings for doctors are actually made in primary care. So influencing that change at the beginning of the journey, we are making sure that that journey continues digitally. Can I have next slide, please? So this slide shows you the value we're delivering from our projects. And but first, I want to talk about what people say and what is the feedback. So the feedback we hear a lot from our attendees in digital cafes is that they really value the human-to-human connection, which always reminded me that digital technology is about connection. It's about empowerment. But in this case, it's quite often also about ability to actually meet NHS staff who is not clinical, who is from digital setting, and to meet them in informal space and be able to talk about future and how we're going to do it together. This is hugely valued, and we are very, very happy receiving this feedback from people. Our cafes perhaps are free to attend by anyone. People visit us to learn how to use mobile sometimes only, or job seekers trying to work online because we are the only source in the area of the PCN or in entire primary care where they can actually seek digital support. We've got elderly trying to connect to family, immigrants starting new life in UK. And people come to us because we break down the barriers for those who feel left behind. And we help individuals of all ages, backgrounds, abilities to gain basic skills which help them thrive in life. We foster inclusion, build trust, and equip people with tools to succeed. But we also space of hope, space, safe space to talk, and space when we can make this change happen. To ensure that our initiatives align with and enrich with wider diversity and equality and inclusion strategy in our ICS, but also our partners, we work closely together. We work with Prevention and health inequalities leads. We work with public health leads, care homes, and diverse community groups. We work with over 40 different community groups. And our work is regularly reported back to them. So we're making sure that they know the progress and what is coming next. We also work closely with local councils and deliver under that umbrella of this project. We deliver support to some of their projects, such as digital car parks or online forms. A couple of our digital hubs holds about 8 people, which are only the staff of combined services in which area. Not only NHS, but council, HUK, or other local services who come together and in one space deliver different services to people coming. The results of our project reflected not only in greater patient engagement, but transformation. And firstly, we observe increase of NHS app use by 10% since the project started. All of our practices enabled core digital functionalities, and we observed steady growth in use of these digital functionalities and services like prescription, appointment management, etc. And these results prove something I always firmly believed, that organizations of all sizes, not only organizations within primary care, NHS, but ICS, play a crucial role in promoting the voluntary adoption of digital services and supporting citizens directly by conversation and creating safe spaces empowers them to make digital choices. Thank you. I wanted to add or show you how our team actually delivers this in very short video we produced, especially to promote the digital cafes and etc. So I will just give me about 10 seconds of, which could be probably disturbing, but I'll try to share it as quick as possible.
The NHS underpins life here in the UK. It's a model that has evolved since its inception.
It's about being one team, one integrated care team with the patients and citizens in the centre, because our motivation should be about improving care.
Integrated care, as far as I'm concerned, is joint-up care. The whole process should be seamless.
If you went to A&E yesterday and you had some blood tests done, I can see them today.
I had a Zoom meeting on my phone where they gave me test results and asked me how I was feeling, and it was everything that I would have done if I'd just gone for one of my average checkups, but without the travel time.
For a person who is more isolated, have literacy issues, comprehension issues, learning disabilities, physical disabilities, it's given them access to their medical records, appointments, their NHS prescriptions. They've got that available to them.
They can see the data, they can change their appointments, they can access services, and everything is visible to them. Independence is everything. Moving freely, doing stuff by yourself, accessing everything, making decisions.
Empowering patients to understand what is going on with their health and take more of an active role in supporting co-management of their health.
To read all the details and make my choices on my own time rather than on the phone with somebody.
I think what independence means is not necessarily going at it alone, it's the option to have the choice.
Marta, thank you for that. The first time I heard about your project on a national I was on a national stage when I heard about it. And I came back quite awestruck because it's quite interesting, some of the words you used today. If you support people to develop skills in wider life, they can also use it for the purpose you're using. And that's exactly what you've done. Rather than training people just to use the skill to use NHS app, which is what we all do in every practice, you've actually made them stronger in their digital skill base. Effectively, it has got a 10% increase in your NHS app utilization. But more importantly, the connection, the human factors, the ability to be able to do their shopping online, the ability to talk to their friends abroad, the ability to use Skype, automatically creates a space that is safe for people to feel, I don't feel left out. Because the reality is, already there are things happening with the AI space that I feel I'm struggling to feel part of. And my children are taking to it very quickly, which effectively means before I'm in my retirement age, which is not very far away now, I'm in a space that I would feel I can't struggle to work with what the way the banking system works, the way my food organization works. So I become more and more dependent on the health service for stuff that I really shouldn't. I should feel there's a level of pride still left in me. And I think that's the word you give them back, that pride, that hope to say, I'm actually quite intelligent, because all these people who are struggling to use technology are accountants, doctors, teachers, nurses who've retired over time, but time's moved on and it's not exactly in the same zone. So it is absolutely brilliant to hear how a simple idea of a technology cafe, which is wider than health service, has given the health service benefits, but more importantly, has given the resident benefit in their lives. So they're in power. And there are people who already put some questions in, and I can see there are some questions already. So let me answer the first one. Is this being recorded? Yes, it is. Correct me, please, somewhere, someone. And it will then be available on YouTube as usual for everyone to have a copy. Like all the other webinars we run, so you'll have a whole string of all the probably 50 odd webinars we've done so far on different topics. Not as unique as this one, but this has a very different flavor to what we're talking about. So Marta, talk us through, clearly, when you've been working on this, what has it felt like from a resident's perspective in trying to become digitally empowered, and what was their feedback? What are the kind of quotes you heard from them on this?
Firstly, a lot of people were surprised at the services delivered by NHS. We do advertise it as an NHS service, but because it doesn't call directly, it's an NHS digital cafe or it's an NHS app digital cafe, we specifically designed the posters and the invites to this event in a way that they invite people to learn something, that they basically evoke curiosity of what is coming up and offer them basic help. But in every time we spoke to someone, we make sure they leave with the information about digital health as well. So they surprised us as NHS, they surprised us as by some people who are actually digital champions or working in digital technology, because it's very unusual for digital staff to be out there talking directly about their projects. So they're very positively surprised. But what they valued the most, they quite often say, this is so needed. We need that on every high street. We need that everywhere. I talked to my friend, she's from another city, to come here because she doesn't have that. We need that in every city, in every village. So they feel it was so needed, and it's still so needed to exist, to support, because we know primary care staff is overwhelmed, especially reception staff. To address people with with skills like that, it's very rare they could help. So creating that outside, firstly outside of the GP sites, create that not busy, felt very safe for them, and they felt that they can talk about their worries about how this digital is actually changing life, and I'm not seeing doctors anymore. Where is that leading us? So it gives us the opportunity to actually make sure people are living with the information and they feel that this is actually something cool, and this is something which actually help us. It's not taking away the services, it's actually helped to reach to more services. So these are the three top feedbacks we receive usually.
Very impressive, very impressive. And I think it's quite impressive how people recognize for themselves a service that is helpful. While doesn't feel like mainstream health, it is without a doubt health in its wider perspective when we talk about the determinants of health. Because the reality is the determinants of health are now so dependent on our ability to link into the various modalities of digital access that are available for them, which are very different from how it was. I mean, even if you remember banking, hardly 8-9 years ago, you used to walk into a branch for everything. They got the hole in the wall, which has been for a fair few years. Then they expanded the hole in the wall so you can even put money in, money out, put in requests, get your PIN change. And before you know, so many branches have started closing because that's where health call's gone. And it's no different to how healthcare kiosks are happening and things are happening elsewhere. But what's phenomenal is, so someone's asked a question. It's a good question. It doesn't quite apply in the circumstances, but it'll be good to hear your perspective on this. We've all been inundated with the banking crisis where the data has been hacked. We have been inundated with the fact that if you go to purchase things, suddenly the M&S website where customer data was taken, so their access to their cards. How do we protect ourselves so that all this data is not hacked? Because a really good question. I mean, I know in this project, it was not about putting in data. It's about gaining the skills to use the site. But what are the things people should think about so they don't become victims of fraud just because they are enhancing their digital ability to use that on a daily basis?
That's a really good question, Wahid, and quite often I got this question in the session or feedback. Firstly, we are making sure when we train people or help them with NHS app or any other health apps, we making sure that they know that that data is not transferred to their device. That data is always safely stored by us, NHS organization, and we make sure that nobody but them have access. That's the first thing. How do they get this access to? So we try to visualize for them that every time you log into your app, you create that contact between your device and GP practice clinical system, which only mirrors the data into your device. So you see it, but if make sure that you log out every time you stop using it. That ensures that only you have access when you use your password and created the password and whatever you created to access it. So that's the first thing. Of course, we can't prevent mistakes, and we are just humans. But these two things, ensuring every time we talk to someone, ensuring that they know the background, how the app operates, and how they can protect themselves from a password perspective, and who should enter their passwords or use that mobile or device, we should be enough to protect them.
Really helpful. And I think it's quite interesting, isn't it, how often we end up using our birthdays as passwords, grandchildren's name, dog's name. And there is something around thinking that through, because it's a very nice primary way of preventing any fraud. But if you have a good, strong password, hard to remember, but always the thing that helps you in life to change. So colleagues, you've heard it from the expert here. I think there's a question about, and I'm not going to read the rest of the question because I don't think it's quite relevant. where someone's made a comment, the elderly are not keen on digitization, and I prefer the waterfall rather than the agile method. So I'm afraid I completely disagree with the question. I'm going to put it out upfront. There is no other way to put this out. I am not going to consider myself elderly, even though I'm about to touch 60. I refuse to accept that in life. I never will. My mother is in her 80s, and actually, she loves digitization. She loves to play bridge, and she does it online with her friends. And often, when I tell her I'll drive you down to your friends, her answer to me is, "Why the hell do I have to do that? Online stuff is available. It's quicker, and I can play at different tables with different people." So I do not agree with this comment that elderly do not want digitization. I think that is really unfair because it's stigmatizing someone just because of age, and that's wrong. That said, many of us are wary of digitization for loads of different reasons. Sometimes it's skills, sometimes it's the unknown of what we are going to do. Sometimes it is the fact that we think it'll get stolen, the data, and we don't know how it'll be processed. And they're all right worries to have. But the reality is, in the older world where we did not get the data didn't get stolen from the cyberspace, it got stolen directly from the houses, or you got mugged on the streets. That is how life was before this. So I think there is um, the good thing about human nature is people who are not straight in life find different ways of trying to get things that do not belong to them. And it is probably using the skills Marta just spoke about things like our password and our security and saving it in places that's not easily accessible, thinking of complex words in our passwords. Those would potentially be better solutions at how we approach this issue. And people are right to be wary. I don't think elderly are wary. I think people are wary, and they should be, because that's the right way to protect ourselves. It's no different to not wanting to walk through a park in the dark because it's a crazy idea. It's exactly the same. None of us know where the data goes. So if the world is moving there, what do you do? Put safeguards around that, and I think there are some really good systems. So we all access our banking online, and it's quite a safe system. Yes, you have some issues, but it's no different to the fact banks used to get held up on gunpoints before this. So we are in a different place. I think there's some really good questions that are coming out from another colleague here who talks about how wonderful it was to hear about the investment you made in the community to educate them and make them feel comfortable on the digital app. And that's brilliant, because actually that is bigger solution to how people feel comfortable, because we all do our shopping online, we all do banking online, we are moving to a world that's highly digital. But like my colleague here, Jamu, says that we're all both learning, and you're feeling this mixture of excitement about being able to learn this new skill and do something different. But AI is new for all of us. And those digital cafes you're talking about are a brilliant concept to get people educated on this. How are you looking to take the next step of creating the educational awareness of what AI would mean in what used to be a very fundamentally simple software of being able to use an NHS app?
Well, we as organization are preparing ourselves for next steps, which includes AI. Specifically for that project, we have no strategy for AI. I think for at least a year or two, we will keep deliver the training and this project in the way we deliver now, because this is the most efficient way we're doing it. I think AI will not be in use to someone who doesn't have digital skills, because all starts with how confident you use your devices and how you use digital services. When you start using them confidently, then you can then start thinking about AI, etc. But even if so, we deploy AI in our service, primary care hospitals. We already have AI in services. It's not called AI, but if you go to any online consultation tools, what you actually do most of the time. You already work with some AI tools embedded in that. So we already doing that. We are not aware of that. If you have consultation in the hospital and you receive the phone call, quite often the phone call is actually led by AI. The questions, which seems, the person asking me nice questions, well, after probably a minute or two, this is not the person, but it sounds like a person. It asks me the right question. It waits for me to answer and make sure that I answer or not. So we already have that. People obviously are a little bit nervous about using AI and how AI can overtake further. This care, they still need that person-to-person care. But I think ensuring that we're not trying to convince everyone. We're not trying to have 100% of the population using digital. We're aiming to have 75% population using digital technology. And we having that space for those who are not prepared, might be never prepared, and leaving that space for those who still will require face-to-face for different reasons, like disability, age, lack of the skills, and many other things that which prohibits them from using digital. So we are accounting for these people. The door for NHS will be always open in the traditional way, and that means they don't need to use digital or AI. And I think talking about this that way ensures and takes away this anxiety that if I don't learn the skills now, then what if AI comes and I still don't have the basic skills, So I think ensuring we try to make people feel that this is their choice. And they making choice to use. We're just talking about benefits. And quite often you mention elderly. Firstly, where is elderly starting? When we start using that term now, because a lot of people in late 60s are still working, are very, very fit, are very, very well, in the digital technology, they really know it. The oldest person I actually worked with was 98. And when I saw the date of birth, I had to confirm that because it was quite shocking to me. And they were they did really well. They were very good at using mobile, and they were really curious about what is this about and how that helps me. And lots of people in lots of elderlies realizes that once the biggest step for them is to actually start going with it, to put all this information, to fill up all these forms, to connect the email with the app, and then the confirmation on the so these steps are the most stressful and difficult. Once the app is there, they can see, what is only 4 buttons there. There is nothing I can do wrong. And whatever I click, I can see something about myself. I can see something helpful. So they're very surprised how easy to navigate is, and they're very surprised what they can actually find, because we keep informing them, and the primary care is telling about NHS app now, but they're still surprised by some of these functionalities, positively surprised, which is good to see. So I wouldn't be scared about AI. I wouldn't make a thing out of it in this project or what we're doing. It's a part of the journey, but it's coming at the speed we can all adopt it at the moment, in the pace where we can learn and make a good use of it.
Brilliant. I think what's fascinating is many colleagues on the questions session are acknowledging and agreeing, and colleagues are sharing some good points around the fact that, and you answered that, so I'm not going to pick that question up. It's around, are we going to ask everyone to have to use these skills? But that's not what you said. You just very helpfully said we are not looking at 100% of people. We're looking at 75%, so that those who can't use those still have access to services, but in a different way, and they would still use the conventional way of the face-to-face approach. But there's a really good point that's raised here, which is about recognizing the impact of loneliness when people become digitally enhanced and start using only digital means of doing it. And if you're looking at rural communities or people who are very elderly, often they don't have many contacts, and the bank used to be a good place. The supermarket's another good place. It may not be in tomorrow's world. And impact of that loneliness is you're depressed, you don't have human contact, your sense of self-worth is impacted, your ability to feel part of community is impacted, and you're more likely then to need more health services despite the digital enhancements that's being provided. So the question really, Marta, has any thought been given to that part of it, or is it so early in the process of rollout that actually you wouldn't have reached that cusp yet?
Yes, we're aware of that, and we hear that from some of the people that they choosing face-to-face because it's an opportunity for them to meet with other people and that loneliness. I think the primary care already established some community links that strictly social prescribing is delivering fantastic services in terms I can go to places and talk about everything else outside of my doctor. So I think a lot of people, and that's been, I think social prescribing has been in place for a few years now. So I think a lot of people in the community is aware that social prescribers have a special meeting. There are walkings, talkings, cafe, other meetings where people, apart from going to GP, can meet and talk about, some health issues, worries, health issues which are not emergency or not requiring meeting a doctor, but just talking and having community to talk about. If you don't have family, it's great. So social prescribing is already fulfilling that role, and because we work closely with social prescribers, every time we hear someone saying, look, but for me the trip to GP to fill out that prescription request is actually my daily exercise, my only time and chance to actually meet. So we try to engage and tell them that there are some services which could be helpful, like social prescribers group, and we work with social prescribers. So when we talk to patients, we can address that in digital cafes as well, because we've got actually social prescribers sitting there and talking to them. So I think we partly fulfilling that, but of course we can't convince everyone to use other services. They still prefer to see someone in GP, and that's fine. I think as long as we have that 25%, and the rest is using at the 75%, we will be fine. And I think we also should support that well-being in some ways in elderly and in that loneliness.
I think that's a really, really good point, and you're spot on. And it's good to see the balance that's being struck in your place of trying to recognize that human contact is as important as digital enhancements. So getting that right. I think there are a couple of good things that are being raised on the Q&A box. One of them is around, if people are being asked to become more digitally savvy, what's the responsibility of staff to make sure that they are logging out regularly, their screens are not left on, they're using screen protectors so no one else can read the information? The kind of things that when you're talking face-to-face is much easier, but if you're doing online, it's not quite the same. And there's an accountability of staff to also be more vigilant, that they could very inadvertently impact the outcome in other ways for the resident, just merely by the data being lost. Is there something special you're doing, or are we relying on the conventional training that staff have on data protection laws and stuff?
We deliver training. So the training we deliver to primary care on our projects, Digital Inclusion and NHS App, only includes material about the project or NHS App information. We also only work in digital hubs with NHS staff or any trained staff from city councils, etc. So ICS sectors. To make sure that every person who actually deals with any training, delivers any support, is trained on data protection. In terms of responsibility of the staff, everyone in NHS has to go through that training on data protection and how to treat online meetings, any meetings with technology, how to keep their devices logged out, and how to access or not access, and what information can be accessed, not accessed, and how to work with public, etc. So we have this training as a part of our work. And therefore, I don't feel responsibility to train people along that project. And I think that's my answer.
So you're relying on clinicians also being vigilant and being careful and actually following the training that they are already receiving, so that
absolutely. So the training we deliver in primary care is usually to admin staff, reception staff, and anyone working face to face. Sometimes they're clinicians, but really rarely at that trainings. So if there is any training for clinicians, it's usually delivered maybe internally after I deliver it to the practice manager and staff, and they forward the materials to clinicians, because we don't always have clinicians in these trainings. So our training consists on information about how the NHS app works like and what are the functionalities. The part when we explain how to access information, it's the same with what we explain to our patients about. You are responsible for creating a strong password and remembering that data, your passwords and login details in your head, preferably, to make sure also that you log out from the session every time you open the session in NHS app or any. But most mobiles actually will log you out. The app will log you out automatically after some time, after a few minutes, unless you told your mobile not to do it, which mobiles have this functionality. But normally, the NHS app would log you out after some time.
I mean, we are starting to run out of time, but there's one more question I'd like to ask, which has been presented. It's a really good question. So you spoke about the fact that it's cost neutral. There's been no additional resources that have been put into the project, and it's been done. So the question that's being asked is, where does the manpower then come from, so that the people could be supported? How does that manpower part work, and who funds it?
So the project started within our team. I lead that project, and I was networking a lot with within primary care, with social prescribers especially, and libraries. So I started to work with libraries and social prescribers to convince them if we can develop another sessions apart from the sessions they already deliver in community. So as I mentioned, that there are some sessions for the community social prescribers run. And I was working with them basically to potentially help out with 1 hour a month for a couple of hours a month in the digital session, working along with me and my colleagues. And this is how it started. So we've got different resources. We've got social prescribers working. We've got people from councils. We've got some people from voluntary sector who run different community meetings. We've got library staff as well supporting this. So this kind of rollout, starting from social prescribing, but developed into cooperation, friendship, and networking with other partners, and being a very successful. When we started it, we ran kind of the test for a few months, which was very successful. So we could share the stories, we could share the outcomes, and it was much easier to basically find more resources from colleagues in libraries and other social prescribers.
Very interesting. Very interesting, the approach you've taken. I mean, this is about tapping into the system and the resources that already exist, rather than costing.
Yes, because libraries were already informing us this. People were asking are asking libraries support. more and more people are coming to library to use digital services, because libraries were initially about books, but libraries now also about digital technology, about the help with digital technology. So libraries have computers, have printers, have even you can borrow some of the technology from libraries now. So they became a point of contact to learn, and library staff realized that this is opportunity for them as well to offer additional service, which was very needed. So they're very happy to cooperate with us on that.
Very interesting, really very, very interesting. And I think it raises the question of, I mean, there are loads of other questions, and I'm sure we'll not get to them because we are coming to the end of this now in the last 4 or 5 minutes. And I did want to say, I think it ushers in a new dawn. It ushers in a new way of working. It brings in both this excitement, but a level of trepidations. It's mixed with both of them, to say this wonderful new world that you're opening up for people to see and to feel more confident and positive about themselves, not feel left out and feel that they can contribute to society is brilliant, absolutely brilliant. Of course, it does bring its own different types of risks, because people working from home, having access, can someone else look at their computer? Are they remembering to do it? Shutting it down? I think there's something around us rethinking, reimagining how people who are struggling are not lost out, how we ensure the strength of the clinician to patient contact is not diluted by someone thinking an app, and the answer from the predictive analysis of an app AI becomes a replacement for a clinician giving that advice, because that's a very different strength. And there are also benefits to that. So getting the right balance between that, I think there's something about recognizing at the end of the day, this relies on people and heart and wanting to do something different. So, Marta, I think what I would like to say in the last couple of minutes is it's probably been one of those, webinars where it's so phenomenally powerful in summarizing an evening that captured what is probably the future of healthcare. It's probably tomorrow's world of how healthcare will work. And I recall years ago, almost 15 years ago, I went and spoke to the team in Nuka because they were doing some things around patient leadership and patients leading the system and communities leading how the healthcare services were delivered. And today, I feel the echoes of that in my ears when I hear about how patients would lead and make a difference. And it's very heartening. It's such a joy to hear something different happening. And I now recognize why you have won so many awards for what you've done there, because actually it's as much the skill you bring with digital enhancements and your understanding of that, as much as it is your passion to make a change. And that shines. Your leadership really shines in this. And I'm very grateful for that. I mean, there were some things you said which were quite eye-opening. Change actually starts in a community and happens in a community. You said there was no additional funding, which is not how we see change. We always see it's more money, more money. We need more money to do this thing. It's also a lot about connections, which we keep forgetting, and we think this is all about technology. It isn't. It's about connections. So I think all in all, I'm incredibly grateful for you to have come and shared today what you've done for all of us. Colleagues, Sophie very, very kindly put up the QR code for you to give your feedback. Please do use the QR code and give your feedback for for us to build the sessions, make them stronger, make them better, make them richer for you. You will have noted, as usual, like every year, we do not run anything in July. It's usually a leave time. Most people are away. So in August, we will have our next webinar on the 20th of August. The QR code is again online for you to register if you would like to. But no webinar is complete without me having a moment to thank the amazing team in the background who make this work beautifully. So, but for people like Sophie, who, when I was having my panic attack just 15 minutes before the start because I couldn't get in, very gently, helpfully guided me through, got me the link so that I was in the webinar. And believe me, I was really stressing out, thinking, oh my God, I can't get into my own webinar. So a big thank you to people like Sophie, a big thank you to people like Anna, who sit and back Sophie as well, so that we have multiple points of contact should something go wrong. And Marta, as usual, an amazing thank you to you for giving us so much of your time today and preparing the presentation. Colleagues, thank you again for joining us today. I hope you enjoyed it and found it helpful. Please do use the QR code to give your feedback, and have a fabulous evening, everyone.
Thank you, Mohit, and thank you very much for coming to this webinar. Good night.